The Minister of Health, Dr. Osagie Ehanire, says Nigeria is not flattening its coronavirus curve with inadequate testing for the virus across the country. Ehanire said this at the Presidential Task Force on COVID-19 briefing in Abuja. The minister noted that most laboratories across the country were operating below capacity, adding that efforts were ongoing to provide at least one laboratory in every state. He noted that only Niger, Kebbi, and Taraba states were still outstanding in the provision of the laboratories. The minister stressed the need for increased vigilance as plans to reopen Lagos and Abuja airports to commercial international flights become a reality. He said that reviewing the COVID-19 protocols to ensure early detection, isolation, and treatment of any positive case had become critical. According to the minister, there had been significant drop in testing due to reduced sample collection across many states.
Our target is to test 2 million Nigerians for COVID-19, of which we have achieved barely a quarter, and to scale up to 4 million persons. For this, the collaboration with states and the FCT health sector structures is crucial. We urge all states and all state organs not to relent in strengthening surveillance and setting up sample collection sites in all local government areas and even in all the wards of the hotspots local government areas. While this protocol may cause inconvenience, like delays at the airport, it is a small price to pay for our safety and our health, and a small price to demand of travelers. As we strive to bring COVID-19 under control, we endeavor to keep our eyes on other diseases that contribute to mortality, especially women and children in Nigeria. We do not want a situation where avoidable fatalities from other causes begin to rival or even surpass fatalities from COVID-19. Malaria is one such example for which we continue to strengthen routine services in our primary health care facilities. This morning, we disseminated the report of the 2018 malaria therapeutic efficacy studies for 3 artemisinin-based combination therapies which were tested in Enugu, Kano, and Plateau states. These studies are conducted at intervals to detect drug resistance to malaria parasite early enough to have treatment that works. The findings from this study have shown that the 3 ACTs, artemisinin combination therapies, shown them to be efficacious against uncomplicated malaria, though there have been reports of malaria parasite resistance to artemisinin in some countries in Asia. No resistance was observed in studies done here in Nigeria. Nevertheless, it is wise to test all fever cases and be sure it is malaria, and to treat only those confirmed cases with this medication. One state, for example, tested over 35,000 in July and less than 20,000 in August, while another dropped from 23,000 in July to about 4,000 in August. These are just examples that show that there may be more work to do and many more challenges ahead. I shall commission a study group of the Ministerial Expert Advisory Committee to begin processes to examine all these developments and to bring up new knowledge which can guide response or may have an implication on government decision-making and spending. With a total of 1,013 fatalities recorded so far, the case fatality rate also slightly dropped to 1.88%, and the gradual fall is possibly an indication of improvement in response and treatment strategies to contain COVID-19, but it is also a common global trend. As long as we still record fatalities from this case, there is no room for complacency until we meet our goal to reduce fatality rate to less than 1%.